Thank you very much for the invitation. It's a great pleasure to be here. And I hope the nepotism is not the only reason why I'm here, Yuri. Anyway, so yes, I'm going to talk about PBPK modeling and in general, mechanistic modeling, how to utilize mechanistic modeling in the cosmetic industry. And I really hope we can revert a little bit that traditional way how the conference is going. So instead of you asking a question to me, I'm going to ask a question to the audience. And the question is already there on the screen. So why is cosmetic industry afraid of using PBPK modeling effectively for its own benefits? So before we go further, just a few words about what PBPK is and what mechanistic modeling is, why it can be so useful, as I believe. So it's a mechanistic modeling, mathematical modeling, which means we're trying to describe the physical phenomena or biological phenomena which occur wherever and whenever the drug is applied to the body. Regarding of the route of administration, actually, today I will focus on the skin, obviously, but the same approach applies to any other formulation, any other type of problem which is connected with the drug. So what's the main characteristic of this approach in general, and something what differentiates mechanistic modeling from the empirical modeling is we do dissect the problem into three parts. So the first one is drug and formulation, or cosmetic and the formulation. The second one is system, which in this case can be either skin or the whole human body. And the third is something what we call trial design, so how the drug or cosmetic is applied. Whole skin, smaller area, different area of the body. Is it skin with hair or without hair, and so forth and so on. So all of that is dissected when it comes to the input and parameterization of the model. However, after that, it's connected with use of those mechanistic IV, PBPK models, which I'm not going to go into the details, but I will show you one example of the equation which we use. So what will be interesting from our perspective when it comes to drugs or which are topically applied or cosmetics, we do have to be able to characterize the drug, including formulation. So it's not only the active compounds, but excipients as well, and how those excipients influence the behavior of the formulation. So beginning from the very basic characterization, like is it a solution or it's emulsion, it's a suspension, down to more complex characterization. I'll come back to that. The system, in our case, will be skin. However, with use of this methodology of machinery, we can, and because of its mechanistic nature, we can, with the use of mathematics, extrapolate it further to different type of populations or different locations in the body, for example, because obviously the skin will be different in the inner forearm and on the back. So the parameterization of the system part is critical, obviously, and that's something what we are responsible for. And we collect all the data and provide different type of populations which can be used by whoever is interested in using it. And at the end of the day, we do have a population prediction. This population does not necessarily mean a population of individuals. If we don't want to go to the in vivo level, we can stick at the in vitro. We can stay at the in vitro level and characterize the skin, but still it will be population, which includes intra-individual and between individual variability. And this is allowed, or this is possible because the model which we developed and which I'm going to use today and describe today, which is called multi-phase, multi-layer McDermott model, can be used not only at the in vivo level, but at the in vitro level as well. So with that, we can literally simulate or run virtual wet experiments without going into the lab. We can simulate the IVRT or IVPT experiments with the use of the IVPT module, which is presented here with use of this cartoon. From the cosmetic industry, I think, I believe based on the assumption that the model itself and the structure of the model has been verified and validated, is formulation. So depending on the formulation, depending on the behavior of how those interesting for us actives have been formulated, behavior of this formulation will be different. In general, this model can deal with all the formulations apart from maybe one, which is available on the market, so solutions, emulsions, suspensions, patches that applies to the drugs and transdermal drug application, obviously. Today, for the sake of time and complexity, I will focus on the, well, simplest, but still not simple formulation, which is solution, or I'll be talking and giving you one example, which will be based on the gel data, solution type of gel. So how it works? There are in general two ways how to deal with that and how to use this model. So the first one is whenever we want to stop at the in vitro level, what we have to provide to the system as an input is information about the formulation. So we do have to characterize the formulation, at least in terms of list of excipients and expected behavior of actives which are present in the formulation together with the excipients. Probably the best idea and the best way is to provide the information about something what we in the drug industry call Q3 characterization. So information about the behavioral characteristic, physical or physicochemical characteristic of the formulation, like rheology, like information about the particle size, density, absolutely critical solubility in various phases. So that's something what should in general come from the lab and should be measured and provided as an input. However, for some of them, there are methods which allow us to predict them based on the more basic data, like solubility in different media, for example. So that's something what can be predicted. What's the normal way of dealing with this kind of information? It's like a starting point for the wet experiment, IVRT or IVPT, where we measure release from the formulation or permeation or absorption, permeation through the skin and absorption to the receptor media. And nothing stops us from doing it, actually. That's the data which we would need from the modeling perspective to validate the model. However, we can start using this model at this stage. So instead of going to the lab, we can really simulate the IVRT experiments and check to what degree, for example, different excipients and thus different behavior of actives will influence the behavior of the formulation. So whether the release will be quicker or slower, and then what we can expect in terms of the permeation through the skin. If we want to go, and that's the tool which can be really used to optimize complex products or complex formulations, even without going to the lab. The next step would be to try to predict what we can expect in vivo. Again, it's not absolutely necessary, but for the drugs or from drug perspective, and for example, bioequivalence analysis, something what has just been presented, that's absolutely critical. So this in vitro experiments or in vitro data, which come from the wet lab, can be used to optimize the model, and we can run the simulation at the level of the human individual or population of individuals, and predict what we can expect in terms of the exposure, both locally in the skin and at the system level. So plasma concentration will be a point of interest at this stage. As I said, I'm not going to go into the details, mathematical details, but I would like to focus on one parameter really, and show you with use of just one random equation. There is a bunch of equations of that sort in the model, how this optimization or utilization of the data which are measured and then predicted or can be predicted can be of use. So in this case, the critical parameter will be partitioning between vehicle and Jagiellonian lipids. It can be measured, but it can be also predicted by the QSR models. So again, we do not necessarily have to measure it There are, in this case, empirical models which can be used to predict that. However, in most cases, it is actually a partition coefficient between lipid stratum corneum or stratum corneal lipids and water. There are a bunch of models here. Nietzsche, Rijkaard, Hansen, all of them based actually on the log p-value. In this case, however, as we know, we very rarely use water as a okay, we use water as a solution, but it's not the only element. It's not the only excipient of the formulation, regardless if it is cosmetic or drug. So we do have to account for other excipients which are present there. And probably the best way to scale this partition coefficient from the water level to the vehicle level is to account for the solubility and the solubility difference between water, something that can be relatively easy measured or predicted, and this complex vehicle, which we use as a base of our formulation, again, for the cosmetic product, for example. In Simcyp simulator, which contains this model, where the model is built in, we do have a tool which allows you to optimize the formulation. So as I said, without going into the lab, you can deal with various components or excipients and assess the influence of those components on, in this case, solubility in continuous phase, and then to be able to optimize or calculate this partition coefficients. Again, it's just an example. There's more of partition coefficients, obviously, that the drug permeates through the skin. And there are diffusion coefficients. So again, they need to be taken care of as well. It's just one example. However, this one actually, whenever it comes to IVRT studies, for example, is the critical one. And that's something what we will be interested in. And that's something what will allow us to characterize and differentiate between different complex products which we're interested in. Okay, so I will use just one example showing you how we can deal with this tool and what kind of data we'll need. It will be drug, unfortunately. I'm not aware of any cosmetic products with that level of characterization in the publicly available data, so I will focus on the drug. However, we'll have pretty detailed information about the formulation. So we'll start from the characterization in terms of Q1, Q2, and Q3. Then IVRT and how it can be used to optimize the model, and IVPT prediction and what we can use or what we can do with the final model, which allows us to predict the in vitro permeation test results. So as I said, it's taken from the literature. It's a paper published a couple of years ago, where they tested 4 different formulations with diclofenac. I will focus on the gel today, as I said previously. So it's relatively simple formulation. However, there are at least 2 components, excipients, which will influence the behavior of diclofenac. Solubility and thus partitioning. It's a propylene glycol, 5% of that, and transcutal, 10% of that. Luckily, authors provided some basic information about the characterization or characterized these formulations. So based on this formulation, we can expect that viscosity will be of some sort, the pH will be of some value. Again, the values are not that important here. The important thing is we do have this data and we can use them as an input to the model. By the way, by differentiating or by using different values which are specific for different formulations, we can differentiate between different formulations. It's not only rheology, it's not only viscosity, it's not only pH, there's more of that. And a good example of a pretty critical type of parameter actually is the size and number of particles or droplets in the formulation. So again, it does not apply to the gel because there are no droplets there, it's a solution. However, whenever it comes to the emulsion or something what is called emulgel, we do expect droplets, and their presence and characteristic will be influencing behavior of this drug because of the partitioning between the droplets and continuous phase, and thus the partitioning between continuous phase and lipids in the stratum corneum will be modified as well. So again, we do use this data. In this case, again, I'm not going to present it today. However, we can use like ImageJ or any other software for the digitization of this data. And we can provide as an input to the system information about the particle or droplets radius disposition, and with that inform the model what we can expect in terms of the behavior of this formulation. So that's the characterization. We take this data like pH, viscosity, and provide it to the system. And the first step was to run the IVRT experiment. And we use this IVRT experiment and the observed data to optimize the model. In this case, the uncertain parameter was solubility in continuous phase. It's not something that was given. We can predict that. I'll come back to that before the end of the lecture. However, in this case, it was decided to optimize this parameter. And with that, or by the optimization of the IVRT model, we're able to predict the behavior of the drug or partitioning of the drug from the formulation, complex formulation, to the subcutaneous lipids. And that's pretty much it when it comes to the optimization. We freeze the parameters, all of them, and since now it's only a pure prediction, so extrapolation. There's no modification of any parameter. We just take whatever was measured and whatever was optimized here, just one single parameter, solubility, and we take it farther to the next step, and we simulate the IVPT experiments. We are running the virtual IVPT experiments. So what you see on the right-hand side is a comparison between the observed data in terms of the cumulative mass permeation and amounts in the receptor fluids, dots, and predicted average plus variability because it was done in replicates. So to account for the intra-individual variability, we run the simulation in replicates to account for sometimes slightly different characteristics of the skin. So again, there is no optimization here. It's purely prediction or simulation. Again, today I'm focusing on gel only, and I'm using this simple formulation just to exemplify certain ideas. However, the same can be done for different type of formulations. So here we see the same for emulsion, the same for emulgel and ointments. With an ointment, it was an interesting thing because there was no permeation to the receptor fluid, so they were not able to measure any concentration. It was below level of quantification. And the model shows us that there is really small amount, but just one thing here though, the model, because of its nature, does not have limit of quantification. The differential equation will give us whatever we want, even at the sixth or seventh place after the comma. So there is something here, but again, it's pretty much negligible. So it's quite good information and proper behavior of the model. The good thing with IVPT experiment simulation is it's not only the receptor fluid. So we have exactly the same information for each and every layer of the skin. And authors measured concentration in different different layer of the skin. So it's not only the receptor fluid, but it's also subcutaneous and combination of epidermis and dermis. So again, without going into the details, here is the comparison between the observed data and predicted data after 24 hours of experiment, when the experiment was stopped. And again, it gives us, based on pure prediction, there is no optimization, there is no extra information given, there's no information about the results, which we expect. Model gives us the information what will be the concentration in different depth of the skin. The same applies to different type of formulations. And again, it's interesting comparison between ointment and gel. Both are solution type of formulations in general, and to be precise. However, their nature is completely different. Much more viscous. Ointment behaves differently, so it does release the drug. The drug goes to the stratum corneum, but it stuck there pretty much, and that's exactly what the model shows. So we can expect relatively high concentration / amount In the stratum corneum, something in the epidermis dermis, probably dominantly in epidermis, and pretty much nothing in the receptor fluid. So again, it's a mechanistic nature of the model, which allows us to deal with this kind of stuff. And here is where I think, I hope and I believe, interesting for R&D scientists from the cosmetic industry story starts, actually, because whenever the model is verified and validated, we can use it to test different ritual scenarios, even without going into the lab. So for example, what I did here, I just changed the solubility in the continuous phase. It's a gel, but instead of, let's say, 10 gram of transcutal, or 10% of transcutal, I gave 15%, or instead of 5% of propylene glycol, we can give 10% of propylene glycol. And with that, influence solubility, among of other things, or other parameters. And we can check or test or ask the model, what will be the consequences, what we can expect later on. And here is the answer of the model. So whenever we change the solubility, we can expect different behavior of the drug. And to add to that, we can track the concentration or amount of the drug in different layers of the skin and compare and optimize the formulation depending on what do we want to achieve, whether we want the drug to stay in the stratum corneum or go deeper to the dermis or permeate to the system, which is not the case for cosmetics in general. The same applies to other parameters. Again, pH of the continuous phase change from 5 to 7, and again, the difference which we can expect depending on the pH of the formulation and the difference at the level of the concentration or amount of the drug in the skin. Again, purely virtual experiment, so it's not something what we have to test with use of IVPD experiment, for example, which would be super painful, I guess, and costly, knowing how much does it cost. So just two take-home messages from me. In general, mechanistic PBPK models can be used for formulation optimization, the virtual testing of the formulation, regardless of the industry, whether it is cosmetic or drug. And the second thing is, however obvious it may sound, I know it's probably obvious for you, but sometimes relatively simple parameters are absolutely critical, like in this case, solubility in the continuous phase. So it's not even a big deal to measure it, I think. And again, it can help us both to optimize the model and then to use the model to understand the formulation, but it can be used to understand the formulation. That's all. So actually, here is my question. Why do you think industry, cosmetic industry, because it doesn't apply to drug industry, PBPK modeling is like a standard tool in the drug industry these days. Pretty much everybody is using it for different purposes. Why is cosmetic industry afraid of using it? And I would like to leave you with this question, because I don't have the answer. Thank you very much.